guys, it's Dr. Eve. Today I want us to discuss something very common in practice: constipation. Constipation affects up to a third of children globally, and more so, it's referred to as functional constipation. And according to the Room 4 criteria, these are children who are having less than 3 spontaneous bowel movements in a week. They're having difficulty passing stool, a lot of straining in up to 25% of their passages of stool. They're having hard, small, lumpy stools. And so you need to think, is it a lifestyle issue? And other things would be behavioral or learned bowel habits that result in this functional constipation. However, some of these cases could be related to allergies. And how this comes about: if a child is allergic to a particular food, once they ingest the food, the gut becomes inflamed. This reduces gut motility, and as a result, movement reduces and the child feels or becomes constipated. It becomes a vicious cycle because once you have stools that are retained in your gut, then you end up with what we call dysbiosis, which is basically the nice, peaceable environment of bacteria and fungi in your gut and the viruses becomes distorted. So, with this dysbiosis, you end up with, again, reduced gut motility, and as a result, you end up with worsening of the constipation. So, how we go about this is through testing. So if you know any child, or if your child is suffering from this condition and they have been seen by gastroenterologists, they're not improving on increased water intake, fiber diets, please get them tested for possible food allergy. One of the commonest culprits include cow's milk, then wheat. Wheat is a very staple food in this country, and if you look at children's diets a little deeper, you'll realize they eat a lot of wheat. The other things would be eggs, peanuts, tree nuts. So here at the Pediatric Allergy Center, we are able to assess your child. We're able to give guided elimination diets for your child, even as we do the follow-up. And one way of also thinking it could be a food allergy is if your child is not responding to the common treatments that they're receiving for their constipation. They have other associated features such as eczema, rashes, family history of allergies in the family, and recurrent abdominal pains that don't seem to go away. So please book your appointment today. We're more than happy to assist you with your child's journey of a good and healthy gut. And so I hope this is helpful to you. Thank you. Bye-bye.